name is Rachel Delavan. I'm the Director of Research at PHCA. So before we get started, just a few housekeeping items to cover. We are recording the webinar and we will make it available on the PHCA website. This webinar has been approved by NAB for 1 credit for nursing home administrators. Certificates will be emailed to attendees in a follow-up email. A link to the handouts was sent in an email about an hour ago in the reminder email for the webinar. The handouts are also available on the handouts pane during the webinar, and we will include that in the follow-up email as well with the certificates. All attendees will be in listen-only mode. You may submit questions using the question pane throughout the webinar, and we will use time at the end of the formal presentation to have our presenter answer those questions. The objectives of today's webinar are to understand the history of the Payroll-Based Journal, develop an understanding of the requirements of the Payroll-Based Journal, and understand how to set yourself up for success. Our presenter is Urvi Patel. Urvi is the Senior Quality Improvement Manager for the American Healthcare Association. In her role at AHCA, she manages the Quality Award Program, a progressive 3-step criteria-based program that recognizes members for their improvements in quality. Urvi also serves as the association's liaison to the Workforce Committee and the National Quality Forum. Urvi has a master's in public health from the University of Michigan. And Urvi, I would like to thank you again so much for joining us today. I'm going to you have control already with your slides. So go ahead and get started, and then when you are done, you can turn it back to me and I'll moderate the Q&A.
Sounds good. Thank you so much, Rachel. And thank you to all of the providers that are on this webinar with us this morning. Whenever I talk to providers about the Payroll-Based Journal, I know that oftentimes the providers can feel like this little man that's in this maze because the Payroll-Based Journal is new territory, and it's one of those requirements where every time you turn around, you seem to have a new wall, a new set of questions that appears before you. And I want to let you know that we at AHCA, and I know the same with Rachel and Dawn, are going to work together to help you as providers navigate through this and really be successful with the Payroll-Based Journal. And so we just want to make sure that you have that in the back of your mind as I go through some of the reporting requirements today. The Payroll-Based Journal first became a requirement as set forth in the Affordable Care Act. Within the Affordable Care Act, it was asked that nursing centers be required to provide direct care staff data on both employed and contracted staff. In addition to this direct care staff information, providers would also be required to submit both census as well as case mix data. And here it really became a requirement because there is this inherent connection between staffing within a facility and the quality of care that's provided. And this is really why the Affordable Care Act is interested in collecting the staffing data to ultimately then be able to also calculate things such as employee turnover and employee tenure rates. And within this requirement, the Affordable Care Act also stated that this requirement should be implemented 1 year after the enactment of the ACA. And so one, when thinking about this, can see that CMS is rather behind schedule because they only last year in their final rule noted that they're coming up with something called the Payroll-Based Journal, which was going to be the system through which they collect this information. And so as much as AHCA has tried to advocate for a delay in the implementation of the Payroll-Based Journal, it's not looking likely. CMS is under immense pressure to get this up and running as they're already behind schedule. And as we note, with each passing day, the chances that this is going to be delayed are really becoming more and more slim. And so I really encourage providers to realize that for the time being, this is starting, and the mandatory data collection period is starting on July 1st of this year. Last year, when CMS published the final rule regarding this requirement, they created something called the Payroll-Based Journal. And with this, they published a manual, at that time, a draft policy manual, and just last week, they published an updated version, which they've also called their final version of this policy manual. And this manual essentially provides all of the policy background on the payroll-based journal. If you or someone at in your individual organization has not read this manual to date, I highly encourage that you take some time to do so. It's 17 pages. It's a really quick overview. It has a number of screenshots, but it's really the best way to start understanding the policy and to start asking some of the right questions as they relate to the policy. The system is known as the Payroll-Based Journal, but I think that this is really a misnomer and something that CMS didn't quite think through, because in reality, what the system is looking for is your time and attendance data. They want to know what the time and attendance is of all your direct care workers, both those that you directly employ as well as those that you contract with. And then it is that requirement that they want to verify against payroll. So just keep that in mind as you're thinking about who you need to talk to and who you might want to identify as the champion of this within your organization. Again, with the mandatory start date on July 1st, CMS is also stating that this is a requirement of participation, which means that it has the potential to be enforced by any of the remedies that CMS has available, such as CMPs, all the way up to decertification. CMS last Friday actually also published an S&C memo in which they went into a little more detail about how they were going to audit the system. So while they haven't said what survey tags they might associate with it or what penalties they might associate with it, one of the things that they did state was that at first they were really going to be looking for a good faith effort, and they were going to work to provide warnings and feedback to providers in the first few months, I think, in the first year, as providers get used to this requirement before they start using any strict enforcement. So as I mentioned, there's three kinds of data that the system is looking for. It's looking for case mix, census, and staffing data. When it comes to your case mix data, this is information that CMS is able to get from your MDSs, and so you don't have to do anything additional as a provider to submit that data. In terms of staffing data, here CMS is looking for you to report for every day for every employee within the quarter the hours that they worked. And so for your direct care staff that you directly employ or you contract with, you need to report per day within the quarter per employee. And when looking at these staffing hours, they're only interested in those hours for which employees are paid. And so, for instance, if you have a director of nursing who is salaried to work 40 hours a week, but as we all know, often probably works 45 or 50 hours, those additional hours that that director of nursing is working can't be reported within the system because the system is only looking for the hours paid. The only exception to this is paid vacation or paid sick leave. Those hours cannot be counted within the system. In terms of census data, CMS is looking for you to report the number of residents on the last day of each month within the quarter. So for the first mandatory reporting period, it would be the number of Medicare, Medicaid, and other residents on the last day of July, the last day of August, and the last day of September. And the way you determine whether the resident is Medicare, Medicaid, or other is dependent on who their primary payer of services is. Someone that might fit the other category would be an individual that would be on HMO, for example. CMS defines direct care staff as those individuals who, through interpersonal contact with residents or resident care management, provide care and services to allow residents to attain or maintain the highest practicable physical, mental, and psychosocial well-being. As you will see, this definition does not include those individuals whose primary duty within the facility is to maintain the physical environment. These are the job roles that CMS has listed as being required within the system. The 37 job roles here in blue are the mandatory job roles that you have to report on. The 3 job roles that are identified in the green font are those job roles which CMS says are optional for an organization to report on. When you take a look at the mandatory job roles in the blue font, you'll notice that this, again, includes those people like the administrator who your center probably directly contracts with versus those such as physical therapists who you would consult with, for example. As you get started getting ready for the July 1st submission deadline, one of the first things you want to do is to take a look at the staff roles that you have within your organization and crosswalk them to those 37 job roles that CMS is asking for. And some of these job roles are similar to those which are available on the 671 forms right now. And so it might be useful to have the individual in your organization that works on those 671 forms help you do this crosswalk. Again, CMS is interested in collecting employed and or contracted or agency staff that is paid directly by the center. And this is a really important distinction to note, that the direct care worker has to be paid directly by the center and cannot be paid for by Medicare or Medicaid or any other sources. So for instance, if you have a director, a medical director, who spends some of his time attending to patients that he bills to Medicare, then those hours that he's billing to Medicare cannot be counted as hours worked in the facility. Additionally, if you have a hospice worker, those hospice workers are often paid by Medicare, Medicaid, or by private pay. And because the facility is not directly paying for those individuals, again, cannot be counted within the system. The exception to this rule is a corporate staff member. For instance, if there's a corporate nurse that comes into your building to cover for your director of nursing and is performing duties as a director of nurse, then those hours can be counted even though that corporate nurse isn't being paid necessarily directly by the facility, but is on the corporate payroll. That nurse is able to have her hours counted. In terms of the employee information, in addition to turning in the hours worked per day for the employees, both your employed staff and your consultant or contractor staff, you have to give each of these individuals a discrete employee ID. And here, when you think about a discrete employee ID, you need to make sure that it doesn't have any personally identifiable information like the individual's social security number or their birth date. And for a consultant or a contractor, say you have 5 therapists, you can't have one direct ID that applies to all 5 of those therapists. You would need to assign each of those therapists their own individual discrete employee ID. You also have to note the hire and termination dates for individuals. And for contractor or consultants, the hire date is seen as the first day that they provide services within your building, and the termination date would be the last day that they provide services for you. You also have to provide coding for exempt, non-exempt, and whether or not the individual is a contract worker. In the past, CMS has also collected data on part-time and full-time status. However, that is no longer a requirement that they're looking for. So you only need to code for exempt, non-exempt, or contract staff. The data needs to be reported within the system for each fiscal quarter. And here you see the date ranges associated with the fiscal quarters, where the fourth fiscal quarter from July 1st to September 30th is going to be the first mandatory fiscal quarter for which this data will be collected. And then organizations have 45 days after the end of the quarter to submit corrections and get the data finally submitted within the system. When thinking about quarters, something that you need to realize is that CMS is looking for a day divide for the work that's being conducted in the facility. And so here, if you have an individual that on June 30th starts working at 9 p.m. and ends work at 6 a.m. on July 1st, then that individual would have to have their hours on July 30th from 9 to midnight counted on June 30th for the third quarter, and then for sort of 12:01 to 6 a.m. on July 1st, those hours would be counted for July 1st and would be part of the fourth quarter. And so this is something that people have been referring to as the midnight divide. And so workers that work that third shift have to have their hours divided by the day in the organization versus by shift. Here's a timeline that demonstrates some of the key milestones within the system. So last year in October was the start of the first voluntary period. And this voluntary period had a data submission deadline of February 14th, because again, it's 45 days after the end of the quarter. The second quarter of the voluntary period started on January 1st and then will end in May with the reporting in May. And then lastly, the mandatory data reporting period starts on July 1st, with the deadline for reporting being 11:59 p.m. Eastern Standard Time on November 14th. So by 11:59 p.m. Eastern Standard Time on November 14th is when all of the information for that first mandatory period needs to be submitted into CMS. There's a couple of ways that CMS allows the data to be submitted within the system. An organization can use manual entry, or an organization can upload the data using an automated XML file upload. And finally, any combination of these two methods can also be utilized by an organization. This is a screenshot of what the manual entry portal looks like within the system. And so here you see that you have an employee listed and you have the days of the week listed, and you can enter in the hours for each day. If you're an organization that has about 200 employees, and of those 200 employees, on average, they work about 90 days within the quarter, that's 18,000 entries that need to be made for the quarter into this portal. So just a little sense of the magnitude of this data entry. With the census data, here you see that for the last day in the quarter, you have to report the number of individuals by Medicare, Medicaid, and other. So the last day of each month in the quarter, you would report that information for census. And then this is a screenshot of XML code. And this isn't really to scare anyone, but it's just to show you that XML is not like an Excel file. It's very different. It's a software data language. And so with an XML form, if you're interested in creating an XML form and using this as your upload feature, you really need either a software engineer or your time and attendance vendor to help you create these XML files. This isn't something that someone just in your regular IT department would necessarily be able to create for you, which is why it's really important to start those conversations with your time and attendance and your payroll vendors to see if they are able to create these XML files for you, and how and what kinds of information they have that they can pull into these XML files for you. As I mentioned, last October was the start of the voluntary submission period. And the voluntary submission period is essentially a time frame before July 1st that CMS has set up where organizations can go into the Payroll-Based Journal portal and submit data and essentially test out the functionality of submitting that data. And this is really the only testing period that CMS is going to have available to providers to go inside the system and to play around in it. And it's really important, and this is something that AHCA is heavily stressing to its members, to register for and participate in this voluntary period. Excuse me. During the voluntary submissions, there is no CMS oversight on the data that's submitted, and so none of the data submitted during the voluntary period will be utilized in the 5-star domain or otherwise be audited by CMS. In fact, we know from CMS that during the years of 2015 and 2016, data will not be used for the 5-star staffing domain. And this is actually one of the reasons that during this time frame, providers have to continue to submit the 671 and the 672 forms. So again, as I mentioned, one of the first things to do is to register for this voluntary period. So you may ask, how am I going to register for the voluntary period? Well, to register for the voluntary period, an organization really requires 2 sets of user IDs. The first user ID is the CMS Net User ID. And essentially, this Net User ID is what allows you to have access to the private CMS network. And if your MDS coordinator probably already has access to the CMS Net User portal, but you want the individual that will be submitting your payroll-based journal data to also have access to that system. So it's important to reach out to that individual and get them set up in the system. And once you receive your CMS Net User ID, you want to make sure that you have all of the appropriate system requirements, and you install something called the Juniper software, which allows you access to the system. And once you do so, you will move on and you'll register and attain the Keys Net User ID. And the Keys User ID allows you access to the Keys system, where you'll collect and submit your data, as well as the Casper system, where you'll be able to see all of your validation reports. Something to note here is that a provider is only able to register for 2 Keys user IDs, but should you need another Keys user ID, you can simply request it from the QTSO web help desk. If you desire, as a corporation, to submit individual facilities information at the corporation level, there's a paper form that a corporation needs to fill out to get access to submit data for all of their individual entities. And if you choose to have a vendor or a contractor submit data on your behalf, that is permissible. But again, they need to fill out a special form that would allow them access to that. And again, if you have someone like a vendor or contractor submit the data on your behalf, you have to realize that you as the organization are ultimately responsible for all of the information that is submitted on your system's behalf. This is just to show you what the CMS Net User portal looks like. So this is what you would go to submit information in order to get your CMS Net User ID and login information. Realize that it can take up to 2 days for that login information to come back to you. Once you receive that, this is where you would go to get the correct software to be able to access the system. And then lastly, this is the portal into the KEYS system. And here you can see where you can click on to submit your PBJ submissions, and also where you can go into Taskbar to get some of the final validation reports on the payroll-based journal. Once you get all of your user IDs, it's important that someone log into the payroll-based journal, and here you see the home page of what the payroll-based journal looks like. And you want to make sure that all of your facility information on this right-hand pane is correct. And if not, you would need to follow up with the QTSO help desk again. So you want to go ahead and make sure and verify your facility information. Once you do so, again, it's really important that someone in your organization takes the time and looks at the policy manual. And again, the policy manual provides a lot of the high-level information related to this policy. And sometimes it might not have all of the answers that you're looking for, but it really will direct your organization to asking some of the correct questions. Once you do so, you want to make sure and crosswalk your organization's staffing categories to the 37 required staffing job roles that CMS has outlined. And again, when you're thinking about this, you might want to already utilize some of the expertise that you have in your organization and consider having someone that works on your 671 forms to help you out. And then you want to add your employee data into the payroll-based journal system. And so for each of your employees, you need to put in their discrete ID. You have to put in their hire and termination. Well, for right now, I think it will just be your hire days, but you want to go ahead and put in that information. And then, since you're still in the voluntary period, you want to try and submit data for at least one direct care staff employee or at least one contract employee or your census data. So within the voluntary period, there's no requirement that you have to submit all of your data. You can actually test out the system by just submitting data for your exempt staff, for example, or just data for your non-exempt staff. So you want to make sure and try that out. And then lastly, if you're planning on submitting data via an XML file, you want to talk to your vendors and you want to see if they're able to provide you those XML files, or if you're planning on creating that XML file on your own, you want to take a look at those technical specifications that CMS has available to be able to create those files and submit them. This is just a really quick graphic on all of the steps that I just mentioned, but this might be something helpful to print out and keep with you as you or the champion in your facility that's working on this project goes through and starts working on this voluntary period. AHCA continues to have concerns related to the payroll-based journal system, and I want you to know that even though a delay is looking unlikely, we're still continuing to advocate for you, and we're still continuing to talk to CMS and sharing our concerns as they relate to the system. Some of the concerns that we have are that hours can only be counted if they're paid for, and so this really affects the exempt staff, where if you have an exempt staff member that you're paying for 35 or 40 hours, any hours that they work over that, you aren't able to report. So we understand that will lead to underreporting of hours, and we're aware of it and talking to CMS about it. Also, this idea of submitting census data on the last day of every month is concerning to us, because we know that that's not necessarily reflective of the census in the organization. Something that would be more reflective would be the average of the month, for example. So we continue to have conversations with CMS around that as well. And then lastly, the simple complexity of the submission process. We understand that those XML files are hard to create and hard to grapple with. We understand that if you have to do the manual data entry, it's time-consuming and it's laborious. And we understand that the way that you have to track some of the hours within your organization also adds complexity to the system. And so we continue to have conversations with CMS related to the pure complexity of the submission process as well. Till date, what we've done is, in addition to having these conversations with CMS, we've also submitted 2 letters to CMS outlining our concerns as well as some of the potential recommendations we have to work on those concerns. We did hear back from CMS on those letters, and while they didn't take us up on any of our recommendations, they did say that they want to continue to have conversations with us as they relate to our recommendations. And so we find that encouraging, and we'll make sure that we continue that dialogue with them. And now I'm really happy to answer any questions that I can.
Thank you, Urvi, for the presentation. We do have a few questions, and I would encourage everyone, since we have quite a bit of time until 11, to keep submitting questions as we go through the Q&A. The first question you may have on your following slides, Urvi, it is, where can we get the manual, the policy manual that is 17 pages that you referenced? I think you recommended early on that everyone read that.
Sure. And so right here on the CMS Payroll-Based Journal website, I have a link right here to it. If you click on it, the manual will be available for you to use.
Thank you. The next question is, if your salaried nurse works 8 hours in his or her normal role and then goes on the floor for another 8 hours as supervisor, will the supervisor hours be able to be counted?
So they can only be counted if you're also paying her for those additional 8 hours as a supervisor. So you have to remember that with salaried workers, you can only report the time that they're being paid for. So if you're not paying her for those extra 8 hours, then you won't be able to report them. However, if you're paying for those, then you certainly can report those. So for any staff member, if you have a staff member that's shifting roles, so for example, if I have a CNA in my building who for 4 hours of her shift acts as a CNA, and for the second 4 hours of her shift acts as an activities aide, I can report all 8 hours because it would be paying her for all 8 hours. I would report 4 of those hours as a certified nursing assistant and 4 of those hours as an activity aide. So the system allows you to provide more than one job role for an individual, but what it really comes down to is whether or not that individual is being paid for the hours that they're working.
Thank you, Urvi. Next question. I think this refers back to when you were talking about, you gave an example about a corporate nurse that comes in to cover for a DON in the facility. And you mentioned that you can count those because they're on the corporate payroll. Let me read the question now, because this may be even bringing in another element of a consultant. The question is, can you please review adding consultant hours again that is paid by a corporation and not the facility?
Mm-hmm. So you can report those hours as long as they're being paid for by your corporation, but you can't. So if the consultant is coming in just to do chart review or to observe something in your facility, then that can't be counted. And it's the same for the corporate nurse. If the corporate nurse is coming in the role of a corporate nurse where she's just there to observe what's going on in your organization and to provide that sort of high-level guidance and feedback, then those hours can't be counted. The reason that her hours are being counted is because she would be acting as your director of nursing, or she would for that day be acting as your organization's wound nurse, for example. And so it's only when those individuals aren't doing that high-level sort of review and observation work, but they're actually doing the direct care work, that their hours can be reported.
Okay, thank you, Urvi. Next question. Getting vendor info seems to be our biggest challenge. Can they submit an XML file directly? There are a few parts to this, so I'm going to read them all, but I can repeat if you need. Do we need to report on their staff hiring and terminations? How are hours tracked for people who provide general support, like consultant pharmacists and some therapy people from vendors? So it's all related to vendors.
So that is one of the complexities of the data submission system, is keeping track of your vendor's hours. And I can tell you that for a consultant pharmacist, you do track the hours that your consultant pharmacist works. And what CMS has stated is that you would have to have some sort of a reasonable methodology in which you convert the hours, the activities of your consultant pharmacist into hours. So your consultant pharmacist, for example, is being asked to attend QA meetings per his contract, is asked to do drug reconciliation per his contract, and so you have to, as an organization, have to have some sort of reasonable methodology in which you're converting the expectations of that individual's contract into hours worked, which you're keeping track of, and then you have the ability to submit those hours into the system and to correlate them back. One of the things that we hear other members doing at this point in time is that for some of their vendors, they're actually instituting a time swipe card system. And so they're asking their vendors that when they come into the building to perform these activities, they swipe in and then they swipe out when they are done performing the care that they're doing. One of the other things that our members are telling us is that because they know that this tracking of time of these individuals is becoming really important, any of the new contracts that they're negotiating, they're actually putting it into their vendor contracts as a stipulation that the vendor needs to swipe in and out of the facility. So then it becomes a requirement of the contract with the vendor. So those are some of the things that our members are doing, but CMS does acknowledge that it's hard to keep track of hours for individuals like the medical director, the consultant pharmacist, etc. And what they keep saying is that the organization needs to come up with some sort of a reasonable methodology in which they're converting the requirements of the contract into hours and keeping track of that.
Okay, I think that answers most of it. One little piece though is, do you know, Urvi, if the vendor can submit an XML file directly?
Yes, so the vendor can, not only can the vendor directly submit an XML file, they can actually also go into the manual data entry portal and manually enter that data. What you would need to do is you would need to complete the form that's available on the QTSO website, which is here, that gives your vendor permission to submit data on your organization's behalf. The one thing I will note here, though, is you have to remember that you are ultimately responsible as an organization for the data that's being submitted in. So I would just, when you set up that relationship, just be careful and be mindful of the fact that you are ultimately responsible for that data going in.
Okay, great. Thank you. Next question. Will we still be required during the state survey to complete the hours portion of the documents, the 672?
Yes, you will. As I mentioned, for the next 2 years, you are going to be required to submit that data. So for the calendar years of 2015 and 2016, you'll have to continue submitting data on 671 and 672.
Okay, next question. Regarding the acuities, how will they be reported? If you covered that, can you repeat?
So CMS is going to get your case mix information from your MDSs. However, at this point in time, CMS has not made clear how they're going to calculate any of the acuity measures, for example, or the turnover or the tenure rate. They haven't provided us any specifications on how any of those metrics will be calculated. Right now, they're only telling us that they're looking to calculate that information, but they have not shared any further information on that. And of course, we'll keep track of that. And anytime CMS does make any of that information available, not only will we comment on it with CMS, but we'll make sure that our members are aware of it as well.
Great, thank you. Next question.
The one thing I'll note on, sorry, I was just going to say, I just wanted to note on that, this idea that in the first couple of years, especially for the year of 2016, I think CMS is looking at this as the first year where they want to check the good faith effort of our providers. And so they're not, I think for now, their big thing is making sure that the providers are submitting the data and you're getting comfortable as providers submitting that data. And I think as they progress into next year is when they're going to start thinking about how this data should be calculated.
That makes sense. Thank you. The next question is, for us, tracking lab and x-ray contractors who serve our facility will be the most difficult to track because they come in at odd hours and the x-ray group is a PRN basis. The therapy staff is no problem. Maybe more.
That is a great question, and this is actually something that we're actively having a conversation with CMS about right now, because we've heard this from other providers as well, that, you know, when a lab worker comes in, they might come in at 3 a.m. for 10 minutes to draw blood, and then they leave, and then they're doing lab work off-site. How are you going to keep track of those hours? And so that's actually something that we recently sent CMS a set of potential recommendations on, such as calculating averages of time that it takes to run certain labs, or foregoing that particular requirement for the time being because those hours are extremely difficult to track. And so that's something that we're actively working with CMS on right now. It was just last week that we sent in those recommendations to CMS, and so we're expecting to hear back either this week or the following week, and we'll make sure to keep our members posted on that particular requirement. But for now, I would say do your best, but within the voluntary period, I wouldn't necessarily worry about that particular staffing category as much as some of the other ones.
Okay, great. Thanks. The next question is about bonuses. If a bonus is given instead of payroll for salary employees, can that be counted?
So that's a really interesting question. We have heard from other members that what they're thinking of doing is that, for example, if my director of nursing is working 45 hours but is contracted for the 40 hours, to pay her bonus for those 5 hours. So technically that can be counted because you're paying her for those 5 hours. However, I would just encourage you as an organization to be careful, because you don't want to get into any issues with the Fair Labor Act. And so just be careful not to wrap yourself into problems with the Department of Labor, because that's certainly a tentacle that penetrates here. So I would check with your legal counsel, to be honest, because that's a little risky.
Okay, thank you. The next question is about how the materials will be made available. I can answer that. I will send a follow-up email, hopefully today, if at the latest tomorrow morning, with the certificate to all attendees, everyone who's in attendance today. There will be a link to the handouts, which are all of Urvi's slides, as well as one we tacked on at the end with some more links to resources. And there will also be a recording of the webinar, so that'll include all of the Q&A we're doing now, that will be made available on our website. I will send that to all attendees as well, the link to the website. So the next question, Urvi, I'm going to read. Hopefully you can understand. If facilities are only to count the hours not billed to Medicare B, how are facilities keeping track of what is and isn't billed to facility, i.e. a lab tech comes and draws from 25 residents, 20 of them are billed to Medicare B, 5 are Medicare A clients, and the facility is billed? This would be the same for therapy, radiology, etc.
So this, again, would be a part where CMS would expect you to employ some sort of reasonable methodology to segment out those hours. I think one of the best things to do is, if you have, like, let's say with that example, you have 20 residents in your building. Of those 20, let's say half of them are being paid by Medicare, and then the other half are going to be directly paid, their labs are going to be paid for by the facility. And let's say that so that's half and half are being paid to Medicare and half are being paid by the facility. And let's say the lab tech comes in that week for 10 hours. Then my reasonable methodology would be that 50% of that time, 5 hours, would be billed to Medicare, and the other 5 hours would be billed to my facility, and so I would report 5 hours. So that would be a reasonable methodology that I would employ. But again, this is a reason why it's good to start these conversations with some of your vendors and your contractors, because you can go to your therapy staff and you can ask them, on average, what are the hours that you're working here, and what is the time that you spend in this other segment of population. So I would start having those conversations, and I would encourage you to have those.
Okay, next question. Are we required to submit hire and termination dates for vendor staff? That seems very difficult to do. I think you referenced sort of the first day they start working with you.
Yes, and so you are required, the hire date is required for your vendor staff. The termination date, you can actually leave that portion blank, but it is required that you put in that hire date. And the hire date is the first day that they're coming into your building and providing services, essentially.
Okay, next question.
And something to note there, I'm not sure if this will help, but when you put in a particular employee into your system, so I put in Jenny into my system, Jenny will always be in my system. Even if I go in and enter a termination date for her, she'll be sort of taken away from the main portal. But if I ever need to go back and reactivate Jenny, like let's say she's a lab staff for me and she comes back 6 months later and I need to put her back in, I would just enter in a new hire date for her, and then she would be populated back in. So the staff that you put into the system are always retained within the system at some level.
Great, that's helpful. The next question is, the other issue complicating lab is that the Part B services are to be excluded. Separating the services that the nursing facility pays for and the lab/x-ray bill to Part B makes this almost impossible.
So I think, Rachel, this is similar to the other question related to the topic. And again, I'll say we at AHCA certainly understand the difficulty with the lab staff and radiology staff in particular. And that's why we're very, very actively working with CMS to try and reconcile this. And I think at some level CMS is understanding the complication with this as well, because they're actively listening to us. So that's one piece. And then the second piece is, as with the other staff categories, try to use a reasonable methodology to the best of your ability, recognizing that the first year or so of this, CMS is looking at a good faith effort. And so if you have a way that you can rationalize and you can provide the logic behind how you separated those hours out, then that is that would be reasonable, and you can show CMS what you're doing and thinking about. They might give you feedback at that point saying one thing or another, but it is your good faith effort that you're trying to meet this requirement.
Sounds like we may need to have member discussions on sharing our reasonable methodologies as we develop them.
Yes, I mean, I think that's a really helpful thing to do, is to share as members because I think sometimes you guys are really the experts, and so you should share those with each other and talk about those. And at some point, if you really come across a gold nugget of like, you figured it out, you know how to do it and you know how it works, sharing that with your state association and with the national association will be helpful, because at the end of the day, everyone's in this boat together.
Yep, I agree. There's only one more question at this time, so I'll read that. And anyone else, if you have a question, please submit now. We still have just under 10 minutes left. Our facility has different departments, and I only handle nursing staff, no therapists, physicians, etc. Would that reporting be done by their own payroll person? So different departments within a facility, can they submit separately?
So, I mean, technically, you could submit the different departments separately. I mean, certainly when you look at these portals, you can have 5 people registered to go into these portals, and each of those 5 people can submit data on a specific segment of employees with this manual entry. That's certainly feasible, and it's something that you can do. I think you as an organization might need to think about what's most efficient for you as an organization. Is it most efficient to have 5 individuals doing this, or is it more efficient to have 1 individual doing this? And I think that's an internal conversation that you need to have. One of the other things that I've heard is that there are times where for the staff that's within the facility that you directly employ, your time and attendance vendors are able to provide you the XML file very easily. And so for those staff, people are going to submit the XML file, and then they're going to go back to the manual entry for their therapist and their sort of medical director, for example. So you can use any combination, and you can really submit the data in any methodology you want. You only have to realize that the data has to be verifiable, and it has to be auditable against your payroll or your accounts payable or the individual contracts. So as long as those things are met, you can certainly split up the work.
Okay, thank you. We do have a couple more. This one is sort of about CMS's justification for having the names of the lab or x-ray submitted. So the question is, to date, I have completed the CMS 671 report with just number of hours for outside vendors. So what is the justification now to have names of lab or x-ray? Right.
So I will be the first to admit that I don't know how to justify all of CMS's actions, and I'm not necessarily here to help provide any insight on that end, because there are times where I don't understand what CMS is doing. With the lab, just to clarify, they're not asking for the names. They're only asking for you to keep track of those individuals that are coming in from the lab. And so you would provide an employee ID for those individuals. And if I had to give a guess on the justification, I think what CMS is really interested in looking at is the hours of care that an individual in your building is getting. And so to be able to report on that, they want to know not only that they're being taken care of 10 hours a day by staff within the building, they want to attribute it to certain staff, because they think we'll all agree that we've also heard things such as the fact that consistent staffing leads to better quality, or that lower turnover rates are associated with better quality. And so CMS is starting to try and track those pieces. And so to be able to track the turnover rate in your building, or to be able to track that retention piece in your building, I think CMS needs that information on an individual basis versus an aggregate number.
Thank you, Urvi.
Not saying that it's right, just that would be my assumption of what CMS is trying to do.
Understood. Thank you. Another question, what is the recommended reporting frequency? Every 2 weeks corresponding with the payroll, or monthly or quarterly?
So this is actually something that the organization can determine. It doesn't matter as long as you're reporting the hours per day per employee. So someone can go in and actually do this on a daily basis, or weekly or monthly. I would recommend personally that if you're looking at the manual entry, you want to do it at a shorter frequency, so you might want to do it on a weekly basis, versus if you're doing the XMLs, then that's probably something you can do every month or once a quarter.
That makes sense. Urvi, we are at the last question. That was it. So I want to thank you again for joining us. I really appreciate it. I want to encourage everyone, all of our members in attendance, to reach out if there are additional questions to me, Rachel Delavan, or Dawn Murr-Davidson, or Gail Weidman. Any of us at PHCA will work to get an answer to your question. You should all receive a follow-up email from me again with all of the resources that we talked about today. PHCA is also working on developing a payroll-based journal sort of portion to our members-only website section to have all the resources in one place there for you as well. So again, thank you, Urvi. And this will conclude our